Hand position for when you're doing your cervical PIVMs or your translatoric joint play needs to be in this lumbrical grip, using this kind of contact. And the transverse process lies right in the actual apex of the curve. So in the spine, it would look like this. PIVM flexion and extension for the cervical spine is essentially the same hand position and head position that you use for your translatoric joint play assessment. Your PIVM is going to include your flexion and your extension, and your translatoric joint play is going to be translating through the motion through the disc. Your hand contact, as we showed on the skeleton, comes laterally. A lot of people like to get too far posteriorly. Make sure you come straight laterally to grab that transverse process right in the center of this. Again, your hypothenar contacts the anterior aspect of the vertebral body, and your pinky and an overlap with your ring finger, if you want, can contact the posterior vertebral body, including the lamina. So you're going to come in laterally, keep the head, do not side bend it or rotate it. We want to keep it straight. And your other hand comes back and can palpate the interspinous process or provide a slight stabilization force if you feel like you need to truly assess the end feel. Your PIVM is going to look something like this, where you bring the elbow up and then you swoop it down. When you swoop, you have to provide a posterior pressure with this contact of your hand. So there's my extension, more contact with this part of my hand. So PIVM flexion, extension, move down, flexion, extension. Translation is straight back and forth. It's better to do a translation in the neutral position of the spine, so you can use your PIVMs to find out here's where it stops into flexion, here's where it stops into extension, here's the neutral position or the resting position of the cervical spine, and now I can translate posteriorly and anteriorly. Again, pushing back with this part of my hand, pulling forward with that part of my hand.